Today we're going to learn more about TMS. TMS stands for Transcranial Magnetic Stimulation. TMS is not electric shock therapy. It's an FDA-approved treatment since 2008 for depression in patients over the age of 12. TMS is also successful in treating issues like anxiety, PTSD, OCD, insomnia, ADHD, addiction, eating disorders, migraines, and tinnitus. Let's talk about how TMS works. Our brains help manage our thoughts by creating pathways that communicate with each other via electrical and chemical messengers. Each type of thought or feeling coincides with pathways or roads that the signals travel along. The more our brain practices certain pathways, the better it gets at doing whatever it is that we practice. It's kind of like muscle memory, but for the neurons in the brain. Sometimes when we're anxious or depressed, our brain gets stuck in these negative pathways, making it difficult to regulate our mood. Let's look at how the treatment works. TMS uses a magnetic coil placed gently over the head. This delivers focused energy to stimulate the neurons in the brain to turn on. And like dominoes, those neurons send messages causing other neurons to fire, which cause other neurons to fire, and so on. This new roadway of neurons reaches deep areas of our brain. Specifically, it creates and strengthens new pathways in our brain that are associated with being happier, less anxious, and more relaxed and content. Imagine sitting in a traffic jam, frustrated, tired, and unable to exit, and then a new path becomes clear and accessible. You take this new path, and you'll probably feel more relaxed, hopeful, and energized. Yay! Here's how TMS excels as a treatment. A single positive thought can strengthen a particular pathway once. A single TMS treatment will strengthen that positive pathway 3,000 to 5,000 times. A typical course of TMS is around 40 sessions and stimulates positive pathways between 120 and 200,000 times. Now imagine practicing a golf swing or tennis serve or song on the piano 120 to 200,000 times. You get pretty good at it. That's a lot like what the TMS process is. The more your brain practices these pathways, the more of an expert your brain gets at feeling happiness and joy, replacing those feelings of depression and anxiety. Now, here's where it gets even better. Traditionally, the 40 sessions of TMS would be delivered once per day for 40 days. For some, a daily office visit can be difficult to manage with busy work schedules and home life. Our accelerated FDA-approved protocol offers 8 to 10 sessions per day, 1 hour apart, with better outcomes than the once-daily treatment. The whole course can be completed in 4 to 6 days. Remember that golf swing, tennis serve, or piano song that you improved with practice? Picture that only taking 4 to 6 days instead of 40. When struggling with depression and anxiety, every day matters. TMS is a safe, non-invasive, simple outpatient procedure. There's no anesthesia, no need for hospital stays. During the procedure, patients can listen to music, meditate, or chit-chat with our friendly office team. After a day of TMS treatments, you can drive home and go about your normal activities. What about side effects? This is one of the greatest things about TMS. Because it is a non-systemic, focal treatment, TMS doesn't have any of the traditional side effects of psychiatric medication, which have the potential to cause weight gain, sexual dysfunction, decreased sex drive, memory problems, nausea and stomach aches, problems with sedation, blurred vision, and dry mouth. The most common side effect of TMS is a mild headache during initial sessions, which disappears over the course of a few days in most patients. TMS is a promising option for anyone who has not benefited enough from antidepressant medication, or for anyone who has struggled with the many side effects of psychiatric medication. TMS is also a clinically proven option for anyone interested in trying a non-medication-based treatment for depression, anxiety, PTSD, OCD, insomnia, ADHD, addiction, eating disorders, migraines, and tinnitus. While TMS can treat severe symptoms, it's also a safe and effective treatment for people who are looking to feel better by being in more control of their thoughts, emotions, and behaviors. For more information or to schedule a consultation, please go to our website, www.kindhealthgroup.com.